on cigarette packs. And by what we got on the National Tobacco Control Regulation 2019, graphic head warnings must be on the packs of tobacco products, and they must cover at least 50% of the front and back. Sometimes we call it the principal display area, while a text-only warning should also be on the lateral sides of those packages. Even for the cartons, text-only warnings are required for about 50% of the front and back of the surfaces. Those warnings, as you can see, will be rotating, which means that every 6 months, every 24 months, the Minister of Health will, bring in some new pictures for tobacco companies to put on their products. We are hopeful. The law has said that this should increase to 60% by the year 2024. And so this welcome development replaces the very old and confusing warnings that Nigerians have known and lived with for decades. The Federal Ministry of Health warns that smokers are liable to die young, very convoluted. And so now you can pick a cigarette packs and you have pictures of what tobacco causes. Take, for instance, the current one says smoking causes lung cancer, and you have images of how there's a good lung and a bad lung. It is important to know that graphic head warnings were recommended in the Framework Convention on Tobacco Control, which Nigeria signed and ratified in 2004 and 2005 respectively. We all know, and WHO also affirmed that the graphic head warnings are more effective, particularly when you're looking at our population where we have large number of illiterates, or what do I say, not too educated people, not schooled people. So by mere checking the picture, the images, and the messages are clearly conveying. And just as I said, when you look at the lateral side, you also see that tobacco smoke contains over 70 substances known to cause cancer. And so since this policy started, we want to commend the Federal Competition and Consumer Protection Commission, known as FCCPC, for their efforts so far. They started enforcement in December 2021 by first, embarking on sensitization, awareness creation in Lagos. And they have also done that in Abuja. While, according to the FCCPC, they found very high level of compliance, they also found out that there are still a few tobacco products without those pictorial warnings. We have also, as CSO, conducted our independent monitoring. And this, the Nigerian Tobacco Control Alliance and CAPPA monitored in 13 states, and those states include Abia, Imo, Ogun, Lagos, Kano, Kaduna, Yobe, Borno, Adamawa, Cross River, and Nasarawa in the North Central. And the exercise targeted shopping malls, open markets, to just see exactly what kind of products. And our interaction with the retailers, kiosk owners, and tobacco product sellers indicate that the level of awareness is still very low, which means that even if you give them the old products, because they don't know what it implies, they might still sell. There are cases, very few cases actually, that we've seen old products that were hidden at the back of the kiosk. And so what we're asking for this morning is that the FCPC and all the relevant government agencies should begin effective enforcement of the law. FCPC starting this particular process is extremely commendable, but we want to charge them as Oliver Twist that they should do more, and that they could extend that to the entire 36 states. And tobacco product manufacturers who do not comply in any way with that section 24(2) of the NTC Act 2015 should be compelled to recall all products, as well as be penalized accordingly. Of course, we are also calling on relevant government agency, the National Orientation Agency, the Federal Ministry of Health, that are saddled with public awareness to pick this up and educate our people that tobacco is dangerous in the first place, but those products without the warning packs are extremely dangerous and should not be patronized. Right now, are we saying any type of tobacco product should be patronized? So there should be interagency collaboration for mass education of Nigeria, and agencies like Standard Organization of Nigeria, and the rest, as I've said, the police, the civil defense, all of them should come in and play their role. That's exactly our call today. It's good we have the warnings, but we want effective enforcement, not only for those manufactured in Nigeria, for any tobacco products that is entering this country. Thank you very much. Okay.
The whole idea of the pictorial, or if you will, the graphic health warning in tobacco control is to say that pictures showing the health consequence of tobacco use or exposure to tobacco products must be shown on the packs of the tobacco product. And it's not limited to cigarettes alone. All manner of tobacco products. That's what that's what the Act says. If you look at Section 20 through to Section 24 of the National Tobacco Control Act, it's clearly spelled out. I don't want to bore you by reading the content of the Act, but if you take your time to look at it, you'll see that the Act is quite explicit. And then beyond that, you look at the content of the regulations also. It's very, very detailed, even provides pictures. Then going beyond the National Tobacco Control Act and the National Tobacco Control Regulations, you also look at the standards that have been set by the Standards Organization of Nigeria on tobacco products. It also contains the same provision on pictorial health warning. So what we find really strange is the fact that tobacco companies continue to market products that are not compliant with this aspect of the law. And what we also understand is that pictorial health warning is one of the most effective ways of deterring smokers and users of tobacco products from using tobacco, because it's quite clear. You pick a pack of cigarettes you want to consume, and then you see what it's going to do to your health, to your lungs, to your system. You know, that in itself is a strong way of deterring people from using it. It also breaks the barrier or the limitation of language. So there is no excuse of, I can't read English, I can't read one language or the other. You know, this is pictorial, and you know, like they say, a picture is worth 1,000 words. So you look at it and you see quite clearly what it will do to your system. And you know, it's quite strange that at this point in time we are still talking about enforcement and compliance. Because before we got to this point, just to take us down memory lane, the Act was passed in 2015. It took us 4 years to get the regulation passed. And this is contained in the Act as of 2015. 4 years to get the regulations passed. After the passage of the regulations in 2019, the law says that there will be 18 months moratorium period for them to mop up all that has been put in the market. You know, that grace period exists. And then the government granted that 18 months period in accordance with the law. There was still no compliance. After the 18 months expired, the Federal Ministry of Health, in its wisdom, also gave another 150 days moratorium. That's another 3 months, to say, just in case you still have some products out there, mop them up, so that after the 150 days, after the 4 years, after the 18 months, and 150 days, then we are going to start enforcement. 150 days expired in, I think, November. This is March, and we are still talking about non-compliance. So it shows that there is a pattern that the tobacco industry just does not want to be regulated. It's as simple as that. The tobacco industry believes that the government is not going to do anything. The tobacco industry believes that Nigeria is just one place where they can come and dump all manner of illicit and unregulated products on the market, believing that there is nothing, there will be no consequence and nothing would happen. And so we are challenging the government today to The ball is in the court of the government, really, to decide whether that narrative is true or not. Are we a country without laws? Are we a country without enforcement? And every law is only as strong as the enforcement of that regulation or of that law. So we are calling on the government today to intensify implementation. Who are those that have a duty to implement? When we talk about calling on government, there are certain agencies and ministries of government that have a role to play. Chief amongst them is the Federal Ministry of Health. The Ministry of Health needs to live up to its billing and begin to enforce. FCCPC has taken the bull by the horn, but FCCPC alone cannot do it. So we need the Federal Ministry of Health, FCCPC, SON to enforce its standards. We need the police to do its job. We need the Civil Defense Corps to play a role, because they are also mentioned in the Act and in the regulations. And also, we also need customs, because we also found that some of the products that are non-compliant are imported products. So we need customs also to, from the port of entry, stop these products from entering into the market. And when these agencies come together and play their parts in enforcing the law, then we are sure that Nigerians' health will be better protected. Thank you.
Thank you very much.